You need to find an independent, science-minded researcher or physician who's looked at the actual data. And there are very few who've done that and are willing to be honest about it. Marty Makary of Johns Hopkins University is one of them. He's just written a remarkable piece in Barry Weiss's Substack, and he wrote it with epidemiologist Tracy Hogue. Makary and Hogue found that Pfizer and Moderna provided, and we're quoting, extremely weak, inconclusive data to justify vaccinating children as young as 6 months in the United States. Quote, using a 3-dose vaccine in 992 children between the ages of 6 months and 5 years, Pfizer found no statistically significant evidence of vaccine efficacy, they wrote. In the subgroup of children aged 6 months to 2 years, the trial found that the vaccine could result in a 99% lower chance of infection, but that they also have a 370% increased chance of being infected. What does that mean? We have no idea. And we don't know how you would know because those data are completely incoherent. They do not present a picture that suggests a path forward. They're inherently confusing. Meanwhile, Moderna, quote, claimed a very weak vaccine efficacy of just 4% in children aged 6 months to 2 years. That is not a statistically significant result either. So based on those numbers, and apparently those are the underlying numbers, how could the Biden administration, how could the people who run public health in the United States of America push for the immediate vaccination of children over the ages of 6 months? We need to assess what exactly these data are and why public health agencies seem to be ignoring them. Marty Makary, as we told you, is a professor of public health at Johns Hopkins University. He wrote the piece we just referred to, and we're honored to have him on tonight. Doctor, thanks so much for coming on. Thank you for taking a look at the numbers behind this. Unless we've just mischaracterized them, they don't sound like the basis for a recommendation for universal toddler vaccination.
That's exactly right, Tucker. It wouldn't even get published in a medical journal with peer review. It wouldn't go through the process. It would get rejected. Now, doctors everywhere in the world, even in the government, should always be free to speak up about their public health concerns. That is a sacred right that we have to guard. But right now, in the government, recently, and this is a trend in the last year, doctors are muzzled. I've talked to many doctors for this piece at NIH and CDC who are extremely frustrated. They're smart people. They know that a vaccine efficacy of 4% doesn't warrant an authorization. They also know that there's no health emergency right now among kids 6 months of age. So I learned a lot. They know the underlying data. They know it's inappropriate. They're not allowed to speak to anyone. If a reporter calls, the communications office has to approve the conversation. And if they want to ask the scientist whether or not they want to do this, they'll say, tell us what you're going to tell the reporter, and then we'll decide whether or not to approve it. At the CDC, a bunch of scientists actually said, look, we recognize the insanity of mass testing, trying to chase down every case of the virus in the United States. It's ubiquitous now. It's not contained. So they came up with a plan to use sampling data like we do with influenza every year and to get better numbers from the hospital of those truly in there for COVID, not just everybody with incidental COVID tests. And that plan was proposed and it was rejected, and they say it was rejected by the White House. And over in the different agencies, I heard from smart people who were just extremely frustrated that not only are they bypassing the normal scientific process, but you really can't say anything because if they do, they know that their jobs are at risk and they'll be treated very differently. One person even said, there's no transparency as to how Dr. Fauci makes his decisions. He doesn't even consult with the real experts. And other people have said other things like it's demoralizing. That one person at the FDA, even who knows the data really well, said that they feel that they're watching a horror show and they can't close their eyes. They're being forced to watch this. If public health wants to restore some credibility, and there's good people in public health, they've been sidelined. The leaders have to have more humility, less absolutism, more answers like we don't know when that's the right answer, and less paternalism. That's the only way we're going to rebuild trust in the medical profession and in public health.
And I think it begins with individual physicians and researchers like you who act on conscience, speak with integrity, tell the truth regardless. That will restore faith, at least mine. So I appreciate your starting that by coming on here. Thank you, Dr. Marty Makary. Appreciate it.